Pregnancy is still traditionally seen as a journey of 9 months, one from which mothers pray to arrive safely. This is one of prenatal sessions that take place daily at the General Hospital Ifakoijaya, Lagos. The women sing songs and dance to show up their confidence. Doctors say prenatal sessions provide important information and care that could save the life of the mother and her baby.
We ask them to eat a lot, to take more of the water, then to eat vegetables, carbohydrates, fat, all the nutrients that you can take. That it is good for them and the baby. Because when you eat, the baby too will eat. So if you don't eat much, the baby will not be able to grow very well. So we teach them to eat total balanced diets.
We want to know her blood group. We want to know her genotype. Does she have an abnormal genotype or not? We want to know her rhesus factor, whether she's rhesus negative or rhesus positive. All these have things to do with the outcome of the pregnancy. A very well conducted antenatal clinic during pregnancy, in a woman, almost ensures 100%, assurance of a safe delivery.
Thousands of African women die yearly while giving birth, despite efforts by global health partners to reduce maternal and child mortality by 3/4 in 2015. Factors like poor quality of health services, poor medical infrastructure, malnutrition and poverty contribute to high mortality rate. Accessibility to health facilities in the rural communities is also a challenge. But it has lately been discovered that pregnant mothers, for one reason or the other, refuse to patronize healthcare centers. In Lagos, where one of the registration criteria is blood donation by their spouses, mothers are often reluctant to register.
People think, why do they want us to donate the blood? Is that the blood they will use the day I will give birth? Is that the blood they will, are they going to use our blood for something else?
Sunday Moses and his wife are here to register for the first time. He says he finds the idea of blood donation scary.
I was scared. And I was scared since the doctor have told me that there's no any problem. So I'm happy about it because she's my wife.
Found out that during the donation, it's not that you just get there and they start collecting your blood. They have to run series of tests like the PCV, Paxel volume, to know the level of your blood, to know whether you are fit enough to donate or not. By the time they do that and they realize that you are not fit to donate, they allow you to go.
But a blood donation specialist says it is relatively harmless.
99% of consumption of our blood is by pregnant women. And there was even a time some concerned husbands threatened to sue Lagos State government. And the commissioner now directs that we should now bring figures, so as to corroborate why they made it compulsory. So, blood is life. It's something that has no alternative. And when it is time to consume blood, you cannot even say, let me wait a bit, because it could be an emergency. The person could be pouring, and as the person is pouring, you need to replace.
So why development partners in Lagos and elsewhere brainstorm on how to reduce all the other factors leading to high maternal and child mortality rate, mothers are advised to jettison the unnecessary fear of the unknown and embrace prenatal care.
We're putting more staff, we're putting more equipment. The resuscitator is one of the new equipments that we're putting there. We're putting lab facilities, we're improving our pharmacy, and slowly we're gaining the confidence of the public back in the services of the primary healthcare system. But we need to educate our citizens on how to use the health system properly.
Except in cases of unusual circumstance or happenstance, getting a proper prenatal care will go a long way in ensuring the mother and the baby are safe during and after childbirth. Wendy Abu, TVC News, Lagos.